guys, this is Felix Ruben, one of the very best YouTube presenters. Welcome back to our YouTube channel. Now today I want to talk about a drug in the family of macrolides, and this drug is called azithromycin. We have so many examples. We have roxithromycin, we have erythromycin, we have clarithromycin. But then today I want to talk about azithromycin because the drug has been used by most of our patients in this COVID era, and so many people have developed resistance due to misuse of this drug, and just buying it over the counter doesn't help, guys, Now, the drug is in a color of titanium dioxide. Okay, you may look at that color, and that is the term that we describe the color, titanium dioxide. Now, this drug, we commonly give it to people that maybe preempt or maybe tend to have COVID-19, but then people believe that the drug treats COVID-19, which is very wrong. Now, these are some of the common conditions that will help you. Actually, the drug will always help in treating some of these common conditions. We have bronchitis, we have tonsillitis, we have endocarditis, we have community-acquired pneumonias, we have traveler's diarrhea, we have both the staph and the strep pneumonia infections. We have chronic obstructive pulmonary disease exacerbations. We have uncomplicated trachomatis, urethritis. We have things like cervicitis. We have things like otitis media. The drug will work so much best and better in some of those conditions that I've just explained, and that you don't need to buy this drug for the sake of COVID-19. Now, this drug mode of action, it is actually destroying the cell wall of a bacteria by preventing protein synthesis. Actually, it is binding itself into the 50S subunit of the ribosomal bacteria. Okay? By doing that, the drug will always help in inhibiting the translation of the mRNA. Actually, it doesn't stop the nucleic activity by binding itself into the 50S ribosomal unit. Okay? Now, this is a drug that doesn't treat COVID-19, guys. It actually will help in treating secondary bacterial infections that come as a result of this viral infection called COVID-19. Now, the drug has got so many uncommon side effects like stomach upset. We have things like flatulence. We have things like vomiting, diarrhea. We have things like dizziness. We have arthralgia. We have stomach upset. So many these effects come as a result of using the drug. Now, stop using this drug for conditions and indications that it's not worth for. Actually, you may use the drug to treat some of the common conditions that we've described, and some of the common conditions that we've actually talked about today. Now, let's stop misusing azithromycin drug. Okay? If you feel like you have these common clinical presentations like cough, headache, nose congestion, things like sneezing, go to the facility where we have a clinician or a medical officer or someone who is qualified to check up some of your symptoms, and you be prescribed the drug by someone who is qualified. Let's stop using the drug, and this drug is going to mess us up in the community. Let's try to avoid using azithromycin in some of these common conditions that is not worth about.